Nutrition risk screening is key for early identification of nutrition issues. It helps identify those at risk of malnutrition or those already malnourished who could benefit from nutrition support. It should consist of two parts: use of a valid, reliable screening tool appropriate to the population in which it's applied, and automatic referral to a dietitian for known high nutrition risk patients. Those with high-risk cancer diagnoses and treatment regimens should bypass screening and be referred directly to a dietitian for early nutrition assessment and treatment. What screening tool should be used? The Malnutrition Screening Tool, MST, is an easy two-question validated screening tool for identifying malnutrition risk. When should malnutrition risk screening be completed? Screening should be completed at diagnosis, repeated at intervals through each stage of treatment, and occur across all treatment and healthcare settings. How should the malnutrition screening tool be completed? Malnutrition risk screening can be performed by any healthcare staff, patient or carer. It may depend on the setting, available workforce, or specific health service policies. Let's go through the MST questions together. Has the patient lost weight without trying? This applies to the past 6 months. If yes, quantify how much weight loss and score accordingly. Only use unsure after you've explored whether you can quantify weight loss by asking, have you noticed your clothes are looser? Or has your belt come in a notch? Has the patient been eating poorly because of a decreased appetite? If the patient is eating less than 3/4 of their usual meal size, then select yes. Eating poorly may be due to other eating issues, such as difficulty chewing or swallowing. Score accordingly. Add your score from question 1 and 2 to get the total MST score. If patients score a total of 2 or more, they are considered at risk of malnutrition and should be referred to a dietitian for assessment and treatment. This score helps nutrition services prioritise work by targeting those at greatest risk. Patients that score less than 2 are not currently at risk of malnutrition, but should be rescreened with the MST at regular intervals to detect any change over time. Remember, nutrition risk screening is key for early identification of nutrition issues in cancer patients. Everyone can be involved. A systematic, multidisciplinary team approach will lead to the best outcomes for your patients and your service.